Good evening, everybody. Just wait for a few people to join and then we'll get started. Thank you for joining me on this blustery evening. Good evening, everybody. Thank you for joining me. We'll wait for a couple more to join and then I'll introduce myself and we'll get started. Fairly blustery evening out there this evening, but okay, great. So we have a good few followers joining us now. So hi everybody, I'm sure a couple of you have met me before on here on Kaliedy's live chats, but if not, just to introduce myself, my name's Lynda Quigley. I'm a paediatric nurse for the last 21 years, still practicing, but also a mum of 3, my eldest being a teen of 15 and my youngest being 9. So I've been through those younger years and I know how difficult it can be. So I just thought this evening that we would touch on 2 basic but really important first aid care, both the first being on a household burn and the second one talking about temperatures. How do we manage them? What do we do? All of that. But just to firstly briefly say about Kaliedy, I was absolutely delighted when they asked me to collab with them. I mean, how exciting, an online baby toy child shop. So much easier than trekking to wherever you have to go to get all your bits and bobs. And most importantly, that they have the exclusive stock list for the early learning toys. I'm a big believer in them. I always bought them for my own. They're well worth the money. They last forever. So do check them out, and their books are fantastic. But also to say that the Kaliedy had their cyber offers on sale and they are across all departments. So from your feeding to your bath time, to your cots, to your pushchairs, to your toys, all of that. So do check it out. I personally did actually order some gifts for my family over the Christmas, and I can guarantee there is next day delivery actually available, and also they've extended their return policy until the 31st of January 2021, so do check it out if you can. So I have a good few people joining us now, so we'll get started. So first off, I'm going to talk about burns, and when I'm talking about burns, I'm talking about household burns. I'm not talking about any other type of burn. I'm talking about your burn from your cup of tea that was on the coffee table that's been pulled down by the toddler. I'm talking about the soup, the piping hot soup that's in the bowl, the water that in the boiling water of the pasta, and the iron that's been plugged in or maybe unplugged and they pull it down on top of themselves. I'm talking about that type of burn, and unfortunately they're very common. And poor parents feel so guilty and so bad about it when it happens, but accidents do happen. So it's so important that you just know the basics, what to do if this does happen at home. So I suppose the first thing to say is remove the cause or the source of the burn. So if it is that plugged in iron, remove it, get it out of the way. Make sure that the area that you're going to now treat your baby, your child, your teen, whoever it is going to be safe. So you've removed what's caused the burn. So whether it's the bowl of soup, the plugged in iron, whatever it is. You're going to be upset, your baby's going to be upset, but try and hold it together to just do these couple of key things, and hopefully then it'll help everybody in the situation. The first key thing, I cannot stress it enough, is to put the burn under cool water. I'm not talking cold water, hot water, warm water, cool water for at least 10 minutes. If you can at all, time it. If you can't, no problem. Just get that burn cooled with the running cool water. So say for argument's sake, it's the arm. They've pulled down the cup of tea off the coffee table. The arm has scalded the arm or burnt the arm. Run that cool water over the arm for at least 10 minutes. Use distraction. Sing a song, give them a lollipop, do whatever you have to do to make sure that water keeps running over that burn for at least 10 minutes. Try and keep them warm though while you're trying to cool down the burn. So if it's a case of that you feel you need to submerge them into water, as in that the burn is on the abdomen, if the garment that they're wearing, whether it's a t-shirt, a top, whatever it is wet and it's not stuck to the burn, whip it off before you try and cool it down. So you pop them in to the water, you've removed the top, and you're leaving that cool water run over that burn for at least 10 minutes. Now, they're going to get cold because you're running cool water over them. So whatever you can do, whatever you can grab that's nearest to you, whether it's towels, blankets, whatever it is, pop them around your child away from the burn site. So you're trying to maintain the rest of that body temperature so they don't get really cold from it. As I said, you try and only have the limb, if possible, under the cool water, but it's key to run that for at least 10 minutes. Now, I'm not a medic. I'm not going to try and be a medic. There's all different variations of burns. But what I would say to you is that a burn might look okay after you've cooled it down with the running water, but overnight or after a few hours, it might look very different. So personally, if it was my child or my baby, it's no harm, and don't ever feel that it's out of range to go and seek medical advice after that burn. Obviously, if the burn is quite severe, you call an ambulance. Totally warranted. If it's a case that you were able to run that water over your baby or child for 10 minutes and then bring them to an emergency department, you do that also, whatever it takes. But the most important thing is that running water, cool water over the burn for 10 minutes. Don't apply any Vaseline, creams, oils, anything like that. But if you've got an agitated toddler that's upset